Well, good evening, everyone. That was so poor. Good evening, everyone. Welcome to the Race, Health, Equity Town Hall here at Malcolm X College. I want to thank both Misty Drake and Liana Lopez for considering Malcolm X for this event on behalf of Wellness West and the tremendous vision that they have for us to talk about race and health equity. My name is David Sanders. I'm the president here at Malcolm X College, and we are thrilled to have this event here. Malcolm X himself would be proud to have this discussion in a building that has his name and represents what we need to do in each of our communities, address the race and health equity disparities that are in our country, in our state, and in this city of Chicago. I'm thrilled to have all of you here, and certainly as you hear this wonderful panel of speakers, I hope that you will take away from this event what is necessary to empower you to do what you must do in your respective areas of influence. It is important that all of us take this seriously and we address what is needed in our own neighborhoods. We are helpers one to another. We got to help each other to be successful. And I believe that this is going to be the catalyst for us to take that responsibility seriously and move forward and ensure that we have the greatest neighborhoods and greatest opportunities for our people, for our children, so that the city of Chicago can be and remain the greatest city in the United States of America. So with that, I'm proud to bring to the mic one of our state representatives. She's around here. Oh, there she is. Yes, I want you to meet and give a warm round of applause to State Representative Delia Rodriguez.
Thank you, President. Appreciate you.
Help me give another big thank you, round of applause to our president of Malcolm X College, Mr. Sanders. Thank you. My name is Delia Ramirez, although I have Rodriguez in my family too, and it's a long story my dad would like to tell you about my grandfather, but that's another time, another place. It is really great to be with all of you today. Es un gran gusto, en verdad, estar con todos ustedes en esta noche. First, before I even get into my remarks, I saw someone in the corner of my eye to the left that I have to recognize. It is the one and only State Representative, Chairwoman of Human Service Appropriation for the Illinois House of Representatives, and even more important than that, my friend Camille Lilly. Who a very long time ago, 4 years ago, when I got to the state legislature, took me under her wings and taught me so much about how to get this work done. So good to see you again. Thank you. So first, I guess this is the second thing. I'm going to thank Wellness West and all of the partners here today that came together to host this important conversation. For those that do know me, as I mentioned, I'm Delia Ramirez, and I'm the state representative of the 4th House District. And by this time next week, God willing, I will be the Congresswoman of the 3rd Congressional District. The first Latina in the entire Midwest to go to Congress, but not the last. And I'm honored to join you tonight because the issue of race and health equity is great importance to me and has been one of my primary legislative priorities in Springfield. The reality is that racial disparities are very much prevalent in all aspects of our healthcare system, from coverage and access to treatment and disparate health outcomes. Just as we have a lot of work to do to address racial disparities embedded in the fabric of our country, Our healthcare system is not immune to these challenges created by centuries of systemic racism, disinvestment, and inequitable treatment. This is why this space gives me so much hope. That not only do we recognize these challenges, but there are many brilliant professionals, stakeholders here who, with a variety of backgrounds and disciplines, are ready to take them on and figure out the solutions our communities deserve. Is that right? In Springfield, I had the honor to be the lead champion to expand healthcare coverage to include seniors regardless of legal status during the pandemic. I got to do that with Chairwoman here, Lily. As of July of this year, 54,000 people in the state of Illinois have healthcare for the very first time for the work that we have done in the state legislature. In tandem with Healthy Illinois, we expanded healthcare coverage, and now if you are 42 years and older, an essential worker, regardless of legal status, state of Illinois was the very first in the entire nation to give you access to healthcare. To me, these are the kind of solutions I know and hope that this collaborative will continue to vision and strive for. I'm a firm believer that the way we achieve true equity in healthcare across racial lines is by guaranteeing universal access to healthcare for everyone. This must be our ultimate goal, and we have to continue to take steps towards that direction. So I want to thank you for your invitation to be here with you today, just 5 days from November 8th. Thank you for the work you're doing, for making space for the critical, important, unapologetic conversations that you will have tonight. And I look forward to working with you in partnership as I transition in my new role, advocating for healthcare equity in Congress. I now have the honor, the privilege, to introduce to all of you a friend of all of us, my soon-to-be colleague, Congressman Danny Davis.
Well, thank you. Thank you all. And I am so delighted to be at the Malcolm X Community College until I don't know what to do. As a matter of fact, to see so many of you that I've had the opportunity to work with for such a long period of time. Expert academic activists, expert healthcare activists, people who are engaged, involved, who interact with each other, who do things as opposed to just talking about them. So thank you all so much. Thank you, President Sanders, for opening the doors, as you always do. I come to Malcolm at least once a month for something that's going on. The only thing that I really do in addition to welcoming all of you is to suggest how important this discussion is. I always say that health is wealth, that you can have every other thing in life that you want. You can have all the money, Jose. You can have all the strength. You can have everything else, but if you don't feel good, if your corns are hurting, if you got fuzzy vision, then you're impacted in a negative way. I'm going to have to run out because I'm going to run out to a prayer vigil that a group of people in East Garfield are having, where 14 people were shot. 14. 10 people in one family. We've been talking about informed trauma treatment all day. But we also have to talk about preventive. My mama told us that she had never been to medical school, that an ounce of prevention was worth much more than a pound of cure. So if we can prevent things negatively from happening, to see people come together, we are so fortunate to live in the state of Illinois. I travel all over America. I travel all over the world. And to see people come together without regard to restrictions, without regard to racial and ethnic differences, come together for the purpose of finding solutions. I commend all of us. I think Wellness West is obviously a well-organized piece of work. I can tell just by looking and the exuberance that people have on their faces, the smiles and the willingness to work. Thank you so much. Have a wonderful, wonderful evening. And I'm just as excited as I can possibly be. And if I'm not here as you finish, just know that I'm still doing public health work. It's all tiny, and we gotta get guns out of the hands of people who should not have them. That's a public health issue. Thank you. Thank you very much. Thank you.
Thank you, Congressman Davis. Let me tell you about my former neighbor, Congressman Davis. You know, when we were, when they were passing the Affordable Care Act, it was this push for so many people to call, to let their elected officials know that they want them to pass the Affordable Care Act. This was on a Saturday. And I was with my grandmother and I said, I'm gonna call Danny Davis' office. And I called his office in DC on a Saturday at 5 o'clock. And who answers the phone? Congressman Davis. So thank you, Congressman, for your work and your dedication, as well as President Sanders and Rep. Ramirez. You guys are our local heroes. You guys are also national heroes, and we appreciate the work that you guys have done for your constituents. As you forge on with the work that you guys are doing locally and nationally, we again just commend your work. So thank you. I do want to say that we do have Spanish translation, and if you need that, the number is here. We just ask that you keep the phone on mute, but please feel free to call if you need that translation. So I probably didn't say my name. So again, good evening. My name is Misty Drake. I am the co-executive director of Wellness West, and it is certainly an honor and privilege to be here today. I do want to certainly acknowledge that Wellness West is formally known as the Westside Health Equity Collaborative, and it is a coming together of really proven, respected and established healthcare and social service providers on the west side of Chicago. They've been doing this work for a really long time. And its purpose is to really create an unprecedented and uninterrupted continuity of care among hospital systems, FQHCs, community health centers, community mental health centers, and social service providers, as well as community residents. It's important to have them around the table. Wellness West is a nonprofit 501c3 organization, and we are funded by the Healthcare Transformation Collaborative of the Illinois Department of Health and Family Services. And so you'll certainly hear from some of our friends at the state about what they're doing in terms of addressing health equity, and so we appreciate Kim McCullen for being here today to bring us those words. So I think many of you around the table, you know, some of these stats that I'm going to give to you, you guys already know it, but quite frankly, it's worth kind of repeating again so that we understand kind of what we're dealing with. So across virtually every health metric, the west side of Chicago, and I'm a west side native, so I grew up on Van Buren and Pulaski. As I mentioned, Danny Davis used to be my neighbor. And I think most Westsiders will know kind of, and those that work in the healthcare field, kind of what people deal with every day. But just to put it in perspective, you know, a baby born, as some of you guys might have heard this, but a baby born in the loop is likely to live to be 82 years old. But on West Garfield Park, the life expectancy is just 70 years. That's a 12-year gap. 60% of Latinx and 67% of Black and African Americans don't receive treatment for mental health condition, compared to 55% of their white counterparts. Major depression was most prevalent among Hispanics, being at 10%, followed by African Americans at 8%, while their white counterparts is 7%. There are significant differences in the prevalence of hypertension by race. White Americans in terms of hypertension is 50%, African Americans is 43%, and Hispanics is close to 60%. And last, diabetes prevalence rate in African Americans stand at about 16% and Hispanics 14%, compared to their white counterparts 12%. So these are the health outcomes that we're experiencing. And then when you couple that with the trauma, when you couple that with the violence, when you couple that with all the social drivers of health, what you have is a need for a model of care that's going to further reduce those health inequities. So I'm supposed to be following these slides then, so I'm going to go off script a little bit. So what are we doing? So we are targeting about 10 zip code areas on the west side of Chicago, and in these areas we're helping those who are have Medicaid and those who are uninsured, because I think what we recognize is that folks go in and out of insurance all the time, and it's important to have that continuity of care. In addition, there are patients are suffering at least one of several medical and behavioral health conditions. And as a result of that, we are focusing on several different disease states, substance use disorder, severe mental illness, hypertension, diabetes, and adverse childhood experiences. There are scores of stakeholders that are, again, engaged in this work with us, and it's important that we really kind of acknowledge this unprecedented work that we're bringing together. These are partners who are partnered on this remarkable effort. Again, as I mentioned, hospital systems, community health centers, social work providers, and we're thankful for them. So I do want to take the time to really acknowledge over 40 providers that have joined our network, and I also want to mention kind of our founding providers of Wellness West, Access Community Health Network, and Robert H. Lurie Children's Hospital of Chicago, Bobby E. Wright Comprehensive Medical Health Center, Cook County Health, Habilitative Systems, Humboldt Park, the Loretto Hospital, Medical Home Network, Rush University Medical Center, Westside United, and Sinai Chicago. And in addition to those individuals, we also have, again, the network of providers. Last, the one thing that I would say is that this work would not be, it would be difficult if we did not take a race health equity lens in what we do. And so part of our focus is also to be accountable to each other, to be accountable to our resources, and to be accountable to the patients that we're serving. So for us, we want to make sure that we take an equity approach. And these are our pillars that we're looking at, where we have a commitment to addressing inequity and racism. We partner with the West Side community and the constituents that represents the West Side community. We want to make sure that we mobilize data and advocacy, understanding kind of where the health disparities are so that we can plan and act. We also want to address the biases in our system, because we all recognize that there are biases in the care that we oftentimes provide to our providers. Sometimes oftentimes it's unconditional. Oftentimes the biases are biases that may not be intentional, but they're there nonetheless. And last, we want to make sure that we are practicing operational equity throughout the service providers that we have. So those are the pillars that are guiding us in our work as we charge forward with how we want to be accountable to each other. At this point, I want to bring up my partner in crime, Liana, who will get us started on our panel and bring up our esteemed journalist who's going to help to moderate the event.
Thank you, Misty. It is my honor to introduce our moderators for this evening's program. Please allow me to introduce Dorothy Tucker from CBS 2 Chicago. Dorothy is a Chicago native raised in Chicago's Lawndale and Austin communities. She has been a reporter for CBS 2 Chicago since 1984. She has been Station 2 investigator team member, and she also is president of the National Association for Black Journalists. Dorothy has been honored with multiple regional Edward R. Murrow Awards and several local Emmys. She has also received the Lifetime Achievement Award from the Chicago Association of Journalists. Dorothy is a local board member with the National Association of Black Journalists Chicago. She's a former board member of Northwestern Alumni Association, and she is a current member of Northwestern University Leadership Circle. It's a lot to say, you guys. She's very popular. Please help me welcome her. I'm also going to introduce our second moderator this evening, Aileen Ocana from Univision Radio in Chicago. Aileen previously worked for Big City Radio, where she provided content for the website and was a midday on-air radio personality. She is currently the host of the night radio shift on 106.7 FM Amor. Aileen is the producer and host of the community show Nuestra Comunidad that airs on 4 radio stations on Univision Radio Chicago. In addition, she hosts Hablando con el Cónsul, a weekly segment with the Mexican consulate in Chicago. She also leads community affairs for Univision Radio Chicago, and she collaborates with the national TV show Despierta America at Univision. Please welcome Aileen Ocana. Aileen and Dorothy, thank you so much for being here tonight, and we really look forward to hearing the discussion tonight with the panel.
Thank you. It is indeed my pleasure to be here. And thank you for that long introduction, but let me tell you what matters. I am a native of the West Side. K-Town, Bryan Elementary, Emmett, Mason Upper Grade Center, Austin High School, CPS. Yeah, I was public in Chicago Public School. I have 3 children. I sent all 3 to Chicago Public Schools. Brag for a moment. And all 3 of them went to Ivy League schools. They're not saving the world yet, but let us hope. So, point being that it is really a pleasure to be here tonight. Most of the things that I do are on the West Side because Mom and Dad, Mom passed a few years ago, but my dad still lives in Austin. Congressman Davis is our congressman. I live in Hyde Park, but I still call him our congressman. As a matter of fact, he walked in tonight and he said to me, I was just writing a thank you note to your father. I'm like, what my daddy do? But I do know that my father has been a longtime supporter and friend of the congressman, as I am, and obviously all of you, and we need him there. So, thank you again, and on to the script that I wrote. It's really good. We are here because we all understand the importance of tonight's discussion that will focus on health equity. I think it says a lot about who we are as a society by how we care for each other and ourselves. We have a lot of work to do. As you heard Misty say, but it bears repeating, the drive from the Loop to Garfield Park is a straight shot, 19 minutes, less than 5 miles. But the life expectancy between those who live in that West Side community and those living in a high rise in the Loop, huge. As you heard her say, the life expectancy is 12 years longer if you live downtown. That is unacceptable. Across virtually all metrics of health and well-being, we have very unequal outcomes. This must change if we are to be the country and the city that we want to be. So we gathered an all-star panel for you tonight to talk about the issues and to present some solutions. Aileen?
Thank you, Dorothy.
It's also an honor for me to be commemorating this important discussion, especially to give voice to the Latino community to talk about health equity. And very importantly, we want this discussion to be mostly about solutions, about what we can do. If all we do is walk up here with an understanding that there is a problem, then we haven't really accomplished anything. As Dorothy said, we have an all-star panel. Each of the 6 individuals are warriors in the battle for health equity, but each have a different role. So the first things we want to do is ask each of the panelists to briefly describe their day-to-day work as a warriors for health equity and give us just a very brief thoughts. I started with the question, what is one way we can move to the needle of health equity? We can start maybe from the left to the right. Dr. Jones?
Thank you. Hi, I'm Art Jones. I'm a primary care physician and also now Chief Medical Officer for Medical Home Network and for Westside Wellness. My background is when I was in medical school, started attending a church on the west side of Chicago in North Lawndale that early on bought into addressing social drivers of health. So what they did was they put up a blackboard and said, what are the needs of our community? This is in the late 70s. First thing was a safe place to do laundry because the gangs had taken over laundromats, so they put washers and dryers in the church. But the next thing was a place for affordable health care, particularly if you're uninsured. They looked at me as a medical student and said, you can do something about that. I'm going, whoa. But that's actually what we did. We moved into North Lawndale. I lived there for 34 years, helped work with that community group to start the Lawndale Christian Health Center. And the advantage is that that health center realized, that, again, that it had to address social drivers of health. So it didn't just start a health center, it started a preschool, it started a legal aid clinic, a development corporation, it started a urban farm. And so really it has, over the years, listened to the community has been empowered. I think what excites me in terms of going forward, in terms of health equity, is projects like Wellness West, which is hiring community helpers from the community, individuals that are from the community, that we train in the model, and they are the most effective people to work with our residents in terms of helping them self-manage their conditions. So as I look at how we're going to address health equity, it is collecting social drivers of health, which is part of that project, is working with community-based organizations to address those social drivers of health, and it is really using the community and people from the community to help and work with their neighbors to improve their health.
Good evening. I'm Dr. Sharon Irons. I am the Medical Director of Ambulatory Services at Cook County Health. I'm an internist for more than 25 years, and I'm also the co-chair of the Hypertension and Diabetes Collaborative for Wellness West. And I'm very excited to be here and to be a part of this discussion. In terms of what I think will move the needle, I mean, there's so many things that can, right? But I think being a physician, I understand that we need to have the right number of physicians, providers, and health care workers in underserved communities. Really looking at what does it take to get there, what is the funding necessary, but really focusing on that. In addition, not just the number, but also looking at the congruence of the providers that are serving the community. So we want providers to be congruent in the sense that they are of the same culture, where they at least understand the culture, or they live in the community. But I want to be 100% clear. I have colleagues of all different classes, races, and they're all great and excellent. So it's not to say that someone of another culture can't serve that patient, but it's important for patients to see, if they look around and say, who are the providers that are serving me? Somebody has to look like them. Somebody have had to walk in similar shoes. It's important to have a number, a percentage that's representing the community. Thank you.
Buenas noches a todos. Good evening, everyone. So my name is Jairo Mejia. I'm an internist as well. I serve 185,000 patients from all over the place in Chicago to patient Ocanas. I'm really happy to be here today with so many friends. Now, if I didn't know you before, now you're my friend. And the reason, we share the same mission. I mean, it's so good to be with people that, we do the same. We care for the same people. At Access, we started the journey of being a medical home for our patients probably 7 to 8 years ago. What we are doing is trying to make sure we solve all the situations and changing the model of care. And I'm very proud to say that we are making that change. We have a medical home that takes care not only for the diabetes or the hypertension, but all the social determinants of health. Now, we're not even close to get to where we want to be, but I think we are doing some strides. I'm very proud to be here today and have this conversation. Now, Senator Davis set the tone. He said, no, don't sugarcoat the conversation, because this is not a time to be politically correct. We are here to have honest conversations about what's happening, about the inequity in health. So thank you so much for inviting me. Thank you.
Hello everyone, my name is Kim J. How are you today? It's so amazing to see so many wonderful faces that I'm familiar with as well, and some new ones that now we're friends tonight too. I've worked with Sinai Urban Health Institute, which is the research arm for Sinai Chicago, for 10 years. I'm a community health worker, 10 toes down in it. I've also added to that title as a trainer for community health workers. My day-to-day job includes empowering, educating, supporting, and breaking down silos through conversations, real conversations that allow people to share their real feelings and allow people to give input on what happens to them and about them. And when I think about what changes need to be made to push the equity needle further toward the right directions, is placing community health workers in spaces and places where our primary caregivers are, where our service centers are, where people are that need things, so that everybody definitely needs something, but what I need may not be exactly what you need, but we still have a need. And community health workers can help bring that equity to the situation. That means providing what's needed for those who come into those spaces and places. So when I think about that, I think about, look at a community health worker, look at the work that they do and what they have been charged to do as an active member of the community, right? They have a stake in it. So because of that, it makes a huge impact on what health equity looks like, because as you have somebody that's in that community, talking about the community, that serves the community. Thank you.
Good evening, my name is Aida, Giachello. Thank you for the invitation. Day to day, I've been working so hard, many of you who knows me, but more recently, working on the COVID-19. Since March 2020, we formed a coalition that is called Illinois Unido. They have been battling and making sure there's equity in distribution, and testing, and vaccination, you name it. So that has taken a lot of my time. I am a researcher, but I'm also a community activist. In research, because I was trained as a community organizer when I did my master's degree at the University of Chicago in the School of Social Service Administration, I decided to take the techniques and the skills of community organizing and mobilize community around health. And at that time, that was relatively new, and people argue that I was one of the earliest persons that started engaging in community-based participatory research, which that means that you mobilize the community decide what is the research agenda, you engage in capacity building so the community could be equal partner in the research enterprise, and we make sure that once the data is collected by the community with technical support from the university, then that information is used for social action to make sure that we could improve and use research to improve the well-being of the community in a given area, whether it's diabetes type 2, asthma, cardiovascular diseases, etc. So I'm very pleased to be here. I'm glad that this forum is taking place. I commend the consortium. They have come together. I truly believe in infrastructure building and capacity building, because I think that those are the tools that remain in our community, that follow community empowerment models, and those are the tools that we need to come up with true solutions that involve community, grassroots organization, community leaders, healthcare providers, and many other sectors. I really commend the effort that the Wellness West has engaged. I suggest to include the business sector, and then you see people representing the business sector and other sector, because we truly want to use the coalition to engage in community capacity building, but also in social change and system change, and to be able to address the diversity in terms of the social determinants of health. Thank you.
Wow, and so I have to follow this group of amazing people. So good evening, everyone. My name is Kimberly McCullough Starks. I am the Deputy Director for the Illinois Department of Healthcare and Family Services, and we are the organization that funded Wellness West. It is out of the state of Illinois, coming up with this very dynamic community first initiative that really brought together this group of dynamic healthcare professionals in an effort to meet the needs of individuals and communities. I can tell you this about me: I'm a change agent. I am an impactor. I am a person that really believes in bringing people together for the purposes of affecting sustainable, holistic change. And I am so thoroughly happy to be here with you this evening and to engage in this conversation. And I really want to applaud each and every one of you for being here, because all of us have a role to play in affecting change as it relates to racial health equity. Thank you.
And thank all of you. If this is the beginning, God, I can only, we have so much to look forward to. Thank you for your great answers. So let's talk first about the clinical side of this issue. And let me start with Dr. Mejia. From a clinical perspective, what types of care, delivery innovations, or practice transformations would have a direct impact on improving health equity?
Thank you. Well, first of all, it's about changing the whole paradigm. And I need to be honest here, as provider myself, we've been kind of arrogant, pretending that we can solve the health issues of our population by ourselves. We need a team. We need a support system that includes everybody, right? We need to bring the social workers. We need to bring all the elements, the social determinants of health. We can't do this alone. So this transformation requires innovation. This is innovation. And Wellness West, and thank you for changing the name, Wellness West is innovation in the making, right? Because it's really addressing what the people and the communities will need. It's not about, again, seeing for diabetes or hypertension or doing a medical visit. That's old fashioned. Now it's about doing meaningful care. Why our people in the near west has to have lower life expectancy than in the north side? There's no reason for that. This is unacceptable. We are in the 21st century. This is just unacceptable. So everybody has to come to the table. We're talking about government officials, community organizations, the providers, and the patients. It's really a team effort. This is what we are doing at Access. We are teaming up. We are addressing social determinants of health, screening everyone for food insecurity, for mental illness, for substance abuse disorder. So it's not only about taking care of the person and, okay, I'm going to give you lisinopril because you have hypertension. That's old. So it's more about the holistic care and the health as a whole system. Otherwise, we will be repeating the same for the next 10 years.
Thank you, Dr. Mejia. Dr. Irons?
Yes, thank you. Very important question. So, what are some important things for transformation that's going on? So first I want to go back to something that really isn't a new innovation, but is something that we need to resurrect. It's something that we really need to focus on, and that is patient self-management. So that's different from education of patients, where it's important to educate patients as part of patient self-management. But what patient self-management is all about is empowering the patient to help really self-direct their care and their treatment. So just as an example, and it may seem like something simple, but it goes a long way. Because an engaged patient is one that is most likely going to have the best health outcome. So for example, I'm an internist, primary care physician. So I'm in the office talking with my patient. And instead of saying, you know what, you need to lose weight because if you don't, your hypertension is going to get worse, your diabetes, and you're going to have a stroke or a heart attack, or that goes nowhere and that doesn't help, right? So we need to really engage the patient. So what I do is ask the patient, you know what, you do need to lose weight, and we need to pick a goal so that when you come back and see me in 4 months, tell me how much weight do you think you can lose? Even if they say just 5 pounds, that's excellent because they're starting to think in the right direction. What is it that you're going to do to lose those 5 pounds in the next 4 months? Tell me what it is. Often they'll say, you know what, Dr. Irons, I think I can walk around the block maybe, 3 or 4 times in a day. Or maybe I can get to the gym, twice during the week. Maybe I'm only there for 15 minutes, but it is a start. And the patient is a part of the shared decision making, and that's where we really need to go. That's what we really need to get to. But also, I want to point out another really important thing that I think is starting to take place, very closely related to patient self-management, is remote patient monitoring. That's a huge innovation. I think it's been becoming more popular in the last few years. And what it is I may have a patient with high blood pressure or diabetes, and I see them in the office. When they come in the office, they bring their blood sugar readings. But what we really want is an engaged patient again. So this remote patient monitoring program, we might partner with another organization to do this. And we piloted this at Cook County Health. It's been excellent. Where we will have community health workers or nurses go out and they will train the patients on how to check their own blood pressure, train the patients on how to check their blood sugars and record it. But more importantly, with this remote patient monitoring, that information is Bluetooth enabled. The patients get the tablets, and that information goes right into the medical record at Cook County Health, and I can see it, right? So I can see, wow, look at all those blood pressures. These blood pressures are under good control, not under good control, so I know when I need to reach out to the patient. And now the patient is also engaged. The patient understands, wow, my blood pressure is in the danger zone, and I know I'm supposed to reach out to the healthcare team. So this is a direction that we really want to go, especially for vulnerable communities, patients that may have issues around transportation, getting back and forth. This, I believe, will really revolutionize healthcare. I mean, we have to have so many other factors, but this is very, very important. Empowering for the patient, and then I get the information. I can look right in the chart and see what's going on with Ms. Jones or Mr. Smith. So I'm just going to say, engaging the patient in their own care is so important. Thank you.
Thank you, doctor. Now let's focus on community. We know that health equity cannot be solved just through the healthcare system or public policy measures alone. It takes an entire ecosystem from the community, and Kim J is one of the front lines of this work. Kim, as an experienced community health worker, can you give us some insight about how all the different parts of a community can work together?
Absolutely, thank you for that question. As a community health worker, I have been privy to a lot of situations by being up close and personal with patients in their home outside the four walls of the hospital. I like knowing that our colleagues who are internists and who are physicians want to have the pulse on what's happening to the patients. I get to spend that time with them to reiterate those instructions and directions that come from the doctor that they really don't grasp in the office. Because many times people, they'll be asked, do you understand how to take the medicine? And they'll go, yes. And I go to the house and I see the medicine sitting on the table and they say, I didn't understand nothing that was told to me. It's not that the doctor didn't say it, but they didn't understand it, and most times patients feel like they are going to be perceived as less than adequate when they ask questions. So to give you an example of a scenario like that, I had an asthma patient who was prescribed medication, and when I'm dispatched, it's because somebody is really having some challenges. So they've been at the doctor quite too many times. So I go to the home. My role is to ask them some questions. What's going on with your care? I mean, show me how you take your medicine. And so one of the patients, mind you, she's an asthma patient, she took her inhaler and she shook the inhaler up, and I was like, okay, that's good. I'm making mental notes. And then she took this cleansing breath, which is a deep breath in and out, which is what you're supposed to do, but most people don't do that. So in my head, I'm like, I'm really impressed now. So I say, my work here won't be that hard. But the next thing she did gave me insight on why she was still sick. She took her medicine and she sprayed it over her shoulder and she did this. And I was like, okay, ding dong, I know why she's still sick. But if she would have gone to the doctor, my esteemed colleagues on the panel, and you asked her, are you taking her medicine? She would have said yes. But she was taking it absolutely incorrect. So those times that we're able to spend with patients allow us to get to the why, to the social determinants have you, because everything is connected to a why. Even when we talk about losing weight, has been brought up before. Sometimes the stressors in the person's life is now allowing them to do any of that. So the pathway to weight loss has to go a different route. So when you think about the community connection that I'm providing as a community health worker, I'm an extension. I'm their eyes and ears outside of the four walls. I'm giving you insight on what's really going on, so when they get back to you, you know the inside. Hey, they have a cat. That's why they're still having this wheezing and coughing. Or no, this house is full of mold. They're not going to tell you that the house is full of mold, or rats or roaches are running around, which are all contributing factors to their condition being more exacerbated. So when you think of the boots on the ground perspective to all of you potential community health workers, I want you to think about why you're even doing this work, because it's passion work. It's heart work. It's not something that you do for a paycheck. You have to do it because you love your community and you want to see change. So as a community health worker, I say I am the equity walking, because I provide my patients with what they need. And I thank the great physicians that we have that give great direction and care, and I reiterate it to make sure they stay on task. So thank you.
Thank you. You can continue there. So I was just gonna say, I'm going a little bit off script. I'm not supposed to be speaking during this period of time, but I just really love what you shared. Because the connectivity between the clinical environment and the patient's home and how they receive information is really important. And so when we get to the section where we're going to talk about public policy, I would just say this. This effort that's being taken on by Wellness West really is infusing a significant number of community health workers within these 6 zip codes that they're working on. And I would say this, I'm from the community. I'm not from the West Side per se, but I consider myself, if we had a coast, I'm bi-coastal in Chicago. I have family members on the West Side, the South Side, the East Side, the North Side of Chicago. And at the end of the day, we really are all connected as it relates to this issue. Big Mama doesn't know how to take her medicine, you all. She doesn't necessarily trust what the doctors say. And I say from a community engagement perspective, when I say that we all have a role in this, yes, you are a community health worker, but I say to each and every one of you where you sit today, I can imagine that you are also navigating and helping your loved ones to navigate the healthcare ecosystem. And so this work that we're doing really is around the patient and, centered around community. Thank you so much. I apologize for interrupting you all.
Absolutely.
But this is real talk. I mean, this should be real talk. That's what this is about. And we're encouraging, a real dynamic conversation.
And no need to apologize. Thank you for sharing. This is everything that we need. And to the audience, before we go, think of your questions, because we will give you an opportunity to ask your questions. And I'm going to join the audience and ask the first question, because I got one, but I'll wait. All right, so now let us turn our attention to the issue of research, because it's important that we can only address an issue if we understand it. So Dr. Giachello, can you tell us about promising research on health disparities?
So if I may, I wanted to address some of the comments that have been made.
All right, girl, you go ahead.
30 seconds. First of all, we have to be very careful when we talk about self-management and helping patient education. We have to make sure that we're not blaming the victim. Why is it that they have obesity? It's because they don't have access to healthy food in the community. Why is it that people are not engaged in physical activity? Because the sidewalks sometimes are broken, or sometimes if you run in the community, people think that you sold something and they're going to go after you. So I just want to clarify that's important. The second aspect about community health worker, I'm a person that I've always been very much training community health worker, and was one of the few early grants from the Center for Disease Control to train community health worker in chronic disease management. So I really appreciate and value. But I think that when we talk about community health worker, we need to see them integrated in the healthcare delivery system, in the clinic. Look at the models in Cuba, look at the model in Costa Rica. There are models there where you see the physician and the nurse together with the community health worker engaging in the different intervention. So I think that we have to look about how can we better integrate them, not isolate them in outreach or education. So that's the aspect in terms of my comments to those two remarks. Sorry. Now going to research. One of the research that is ongoing and for which we need all of you to enroll is called the All of Us program. That is an initiative of precision medicine under the Obama administration. He realized that people of color, people with disability, older people, women as a group, were not invited to the same degree in biomedical research. And so we need to come up with an initiative that is called All of Us, that we represent the United States population. So the All of Us program is again part of precision medicine, which is a new trend in medical care that is trying to tailor your medical care based on individuals, taking in consideration their lifestyle, medical history, genetic, environment, and many other factors. And therefore, we are currently inviting 1 million people nationwide to be part of the All of Us program, which really means that you could fill out an online survey, or if an interviewer could help you if you don't feel comfortable with a computer, provide consent, provide medical record consent, and then get into a brief physical exam. You get compensated for that effort. And you will be able, as benefit, to get not only all the results of the study, but you will be able to get your genetic ancestry and the kinds of predisposition that is genetically based that runs in the family, that sometimes because of secrecy we don't know about it. So there's a lot of benefit, and I do have Humberto Nava in the back with brochure that could tell you how can you be able to enroll in Precision Medicine All of Us program. The second study underway is about sleep disparity and cognition. And what happened right now, the racial and ethnic minority tend to have poor sleeping habit, either because they either sleep too much or sleep very little, they work overnight in multiple jobs. And as a result, we want to explore if there is a relationship between your sleeping patterns and your potentially developing dementia or condition, meaning processes thinking and other elements that may be impacted because you're not sleeping well. So we have Sarah Hickman with brochures and information about how can you enroll right now in that study by Northwestern University. And actually, precision medicine is also part of Northwestern University in partnership with the University of Chicago, Rush University, University of Illinois, and North Shore, Cook County Hospital. There are a number of partners that's trying to help in reaching this 1 million people enrollment. The other study
I'm just wondering, for the sake of time.
But anyway, there's a
perhaps
lot
we'll-
more, but the last one, if I may,
Is it going to be like maybe 15 seconds, you think?
Yes.
Okay.
It's at University of Illinois, the low COVID study. That study is trying to assess to what degree people who have COVID in the last 3 weeks, they want to enroll those, are really one of the mild and severity condition that they have as a result of COVID. So I have information about that as well. Thank you.
Thank you.
We can see the passion of Doctor. Thank you so much. Now it's time to talk about public policy. We know that governments and the public sector play a major role. Governments have the scale and the resources to help that is just not available in philanthropy or the market. So let me ask Kim McCullough specifically, tell us about what the state of Illinois is doing and perhaps more broadly the further role that the public sector can play in increasing health equity.
So thank you very, very much for that question. First, before I answer, I do want to acknowledge State Representative Camille Lilly, who's sitting in the room. Representative Lilly, I want you to stand up because I want people to see you in the room. And I say that because she has been a strong advocate for health equity in the state legislature. She co-led, along with Senator Hunter, the Illinois Legislative Black Caucus's healthcare pillar.
Yes.
That particular piece of legislation has been very impactful in trying to create and include policy in state government that's going to have a positive impact on our communities for years to come. Let me talk a little bit about HFS and what we do. Our mission is to provide quality access to care, to health care for all Illinoisans across the state of Illinois. There are several different initiatives that we have embarked upon here within the last 2 to 3 years under this current administration, which have been really significant. One of the things that the doctor talked about is the utilization of electronic monitoring equipment to really avail patients to be involved in their care. This administration actually advanced and opened up telehealth in the state of Illinois very rapidly to allow for patient monitoring to occur. And for those Illinoisans who have challenges in the behavioral health section, to have access to clinicians where we, quite frankly, have a little bit of a challenge right now, not only in Illinois, but across the country. So I foresee that there's going to be more to come with respect to telehealth because that modality does increase access in a very meaningful way. I would also like to talk about healthcare transformation. Healthcare transformation is an initiative that is roughly $150 million opportunity for community-based organizations, health institutions, CMHCs, if you will, FQHCs, to come together to work on a particular health concern for a particular area within the state. Wellness West, which is now called, and I do love the name, was one of the first collaboratives that we awarded funding to. And what makes this unique is we weren't funding institutions, we were funding collaboration. So it's multiple institutions that came together for the purposes of addressing an issue. In the center of all of that are a couple of things that have been discussed here today. One of them is the inclusion of community health workers to make sure that we were touching patients where they were to help to further trust of the healthcare system and to make sure that they understood how to avail themselves to what was being recommended to them in terms of their care management. The other thing that we really wanted to see happen was the inclusion of community-based organizations who are working in healthcare, working in communities every day that have relationships with the patients that are being served in the delivery of care. We also wanted to see hospitals work together, to see FQHCs work with hospitals in delivering services to our customers. There were 9 different collaboratives that were awarded funding during this first round. We are now right in the midst of awarding to 6 additional collaboratives, many on the south and the west sides of Chicago, so it's very equity focused. We encourage data to drive decisions with respect to the areas that they were working on, and we encouraged them to work directly with communities so that they could then have input into the process. So when you talk about what public policy can do, public policy can encourage and break down barriers where barriers exist. Encourage institutions who had not heretofore found a way or a mechanism to work together. We incented that in this particular initiative to get institutions to work together. And so that's just one example of how public policy can impact health equity. And I see you coming to the stage. I have many, many more things that I could share, but I won't, I'll stop.
We know that for the next invitation. Thank you so much. Now let's get a view from the national perspective from Dr. Jones. Dr. Jones, we have been looking through these with a Chicago lens, but give us an overview of what's happening nationally.
So there's not much we can say about it that's come good out of the pandemic, but one of the things has certainly been an increase in healthcare coverage. So you may or may not know, but the federal government, when the emergency started back now 3 years ago, decided that they would increase funding to the states to increase their Medicaid enrollment, but on the one condition that they wouldn't disenroll anyone from Medicaid during the next 3 years. And so what's happened as a result of that is that we now have 90 million more people on Medicaid than ever before, so 90 million. We've reduced our uninsured rate, so that's 20 million people more than before the pandemic. That's the good news. The bad news is that now the emergency period is about to end. I guess that's good news too. But in terms of eligibility, it means that people will, for the first time in 3 years, have to go through redetermination. It's estimated nationally that between 5 and 13% of Medicaid beneficiaries will lose their Medicaid coverage, but a higher percentage of them will temporarily lose them because they don't understand redetermination. So one of the things that really is being advocated now is for community people like you and community organizations to help people to be prepared for redetermination for their Medicaid benefits. The individuals that are most likely going to suffer from that are those that have limited English proficiency, those who have moved, and those that are disabled. So certainly that is a big issue. I think nationally, when you look at disparities, we have to realize that we still have 12 states that have not expanded Medicaid. One of the things about the federal government was that they allow for that redetermination to occur over 12 months. Which Illinois has taken advantage of, as 40 other states have, but there still are 10 states that have decided that they're going to go through redetermination much faster, again, meaning that there's going to be more disparities. On the good side of things is that the federal government is now much more attuned to social drivers of health. So they use a system called an 1115 waiver, which allows states to experiment with new innovations to how to improve health outcomes. So right now there are 14 states that have approved waivers, which gives them dollars to implement new programs specifically around social determinants of health and addressing those. And another 10 states have applied for the waiver, and so that is really good news. The other thing we're seeing is that the states are expecting their health plans, their Medicaid health plans, to identify and address health disparities and emphasize social determinants of health. So that's coming out in all of the RFPs as those states choose new health plans. Hey, how are you going to address health disparities? How are you going to address social drivers of health? How are you going to come up with a population health plan? And then finally, what's happening is that these Medicaid managed care, and often with the urging of the states, are saying that you need to move away from just paying providers for providing services, that you need to pay them for actually outcomes, improving patients' health and health outcomes, which again, the only way that's going to happen is if in addition to providing good access to medical services, we also address social drivers of health. So I do think there has been certainly a heightened awareness of disparities as a result of the pandemic, and you're seeing the CMS and state Medicaid agencies respond to that in terms of what their expectations are of their health plans and also their providers.
Thank you. It is now time for the audience to ask questions, and we have a microphone that will be floating around while you guys think about your questions. I am going to ask my question under the title of community. When my mom was rushed to the emergency room and subsequently died, afterwards I began to ask all kinds of questions. What happened here? Why? One of the main questions that I asked was, why is it that the internist, whoever it is in the emergency room, why did they not read everything that was in her file and do the very thing that would cause complications? That's what they did. Why didn't they read her records? And, you know, I'm talking to everybody, and I'm talking to everybody inside, outside, and someone said to me, Dorothy, she was an old black woman who was probably going to die anyway. And that may have been the attitude. So my question to you is, how do we change the culture? How do we improve the culture for black and brown patients to get the same level of caring that non-minorities receive? What do we do? Anybody?
We don't have a microphone.
Oh,
So, since I have it in my hand, I would say this, that one of the things that we can do to change the culture is to do exactly what we're doing in terms of trying to train community health workers to educate patients about advocacy for themselves, to understand how to navigate the healthcare system for themselves. I think the other thing that needs to happen is it's all about pipeline. It's all about pipeline in terms of making sure that those that are, you know, from various cultures, minorities, understand how to avail themselves to health education and know that it's not always necessarily about being a doctor or physician. There are administrators in hospitals that can set policy, that do purchasing, you know, that can affect a change. And so that would be my comment.
Giachello.
I think that for sure, we have to increase the pipeline. I mean, right now, the number of African American and Latino going to medical school and other health professionals is like 3 to 5%. We have a severe shortage of professionals. Studies have indicated there is biases in the system. And the biases is not only among healthcare providers, they have been socialized with all this negative attitude against racial and ethnic minority and against poor people, for which they don't prescribe the state-of-the-art medication because the physician believe that they cannot afford it to buy it, for example. So there's been studies after study that have documented, even the Mount Sinai Institute had a survey, a year ago, they clearly indicate more than between 25 to 30% of patients that were interviewed in terms of their care in different citywide hospitals and clinics were saying they were discriminated by the nurse, by the receptionist, and clearly by the physician.
Thank you. I'm going to say, I got a two-pronged thing. I'll be really quick about it and succinct. There needs to be a shift in thought processes and a shift in understanding how you deal with the community that you're working with. Number one, we have to deal with what happens systemically to people of color. Do you want to know what happened to that black grandmother? She didn't want to be there because she didn't trust that anybody was going to truly take care of her. So we had to create a shift in the thought processes to let somebody know that you have a right to speak about what's happening to you, and I'm going to help you do that. So that empowerment component comes along. And then Doctor, you spoke about the teaching the doctors. I agree with that. Getting them in the beginning to let them understand that when you go into communities and you're going to serve a community, you need to understand who you're working with. You need to understand the challenges that they have. You need to understand how they talk, how they dialogue, what their hand movements mean. If you're going to come here and say you're going to provide care, I've seen it up close and personal happen, but I also have been a part of the change. I've been the voice for my patients, and I've also been the voice at the School of Medicine where the new doctors are being churned out. They know about community health workers because they heard me talk about it at their grand rounds. They understand that if I'm going to have a practice and I'm going to do this work, let me grab a community health worker too so they can help me get this level set. A lot of our patients that we deal with do not like the doctor because of what they've experienced and what they heard about, the Tuskegee experiment, Henrietta Lacks, all these injustices. They have to be addressed. It is the elephant in the room, and we have to deal with that. And as a community health worker, I'm helping to slap that away because I'm becoming the face of what healthcare looks like. You know, I want my mom, my grandmas, my nieces, and my cousins to say I can go to the doctor and I trust that I'm going to be taken well care of. Because if not, Kim J's coming.
All right, well, let's
Let me talk on behalf of the doctors here. Before you start throwing word barrels to us, right? We are looking for solutions, you know. Number one is we don't ask, we request, we demand from our 245 providers to treat every patient like a family member because they deserve that. Now, let's talk about the time of the visits, right? You go to Northwestern, you go to University of Chicago, how much time did the doctor spend with you? At Access, we were brave enough to change the time, and we doubled the time for the visits. Because what can you do really in 15 minutes? You know, you just put orders. So the equity starts also with a systematic approach, because we can do anything in 15 minutes. So it's just one example of things that can happen to the provider side.
All right, we're going to move to the audience. Thank you,
As a child, adolescent, and adult psychiatrist, and first and foremost, Dorothy Tucker, I gotta tell you, I can relate completely. I was at Illinois Masonic, and I shouldn't mention the name, but my 94-year-old mother had just had a subdural hematoma, hemorrhage, and I asked to speak to the doctor. The nurse, I repeatedly asked her, because she only has one kidney, so I wanted him to get vital information. She said, "You will respect me or I'll have you taken out with security." I never raised my voice, and Mr. Sanchez knows I don't raise my voice, because I have a therapeutic voice. But in addition, I also trained psychiatrists for 12 years. 12 years, okay, with the American Physicians Institute for Advanced Professional Studies as a mock oral board examiner. And I can tell you, just like the lady said, when one message was going this way, the other message was going over there. And one of them said, "I can't because I've never sat down with a black person." And I said, "Well, you're going to now. You're going to walk away from that elitist clinic you're at, and you're going to work in the West Side or the poorest sector you can find in the Dominican Republic and learn." And the other thing I will say about doctors, and I am one, so I'm not going to, don't worry, Mr. Mejia, but I will call them out when they need it. And unfortunately, I have. And I've paid the price for it. And I'll just share this right here. I pushed very hard, very hard, very hard.
You have a question, or you? I mean,
I want to comment.
Okay.
Many of the patients say, make them mental health literate. No. What our doctors and providers and mental health workers need is to become socially literate, because cultures are different. And cultural competency is a myth. It's a proficiency, just like non-English proficient patients, it's cultural proficiency. Get out of your offices, meet people where they're at, meet them in their locations, and find out about their culture. Put a bunch of different people in a room like this and have them interact. And I think that would go a long way.
Thank you. I know we have a lot of professionals in this room who can add to this conversation. And we definitely appreciate your being here, appreciate your comments. But I'm going to ask if there are others who perhaps have questions as well. You know, I would encourage those. Most of you may know some answers and can contribute, and most of you probably can. But you know, let's see if we can get some questions asked here.
And go to your patient relations department if you get treated like Rican.
Hello everyone, my name is Marquita Sims and I'm also an activist as well, outside of doing all the great works that I do in my school environment and everything else. But I had a son, my son was shot and I had to go to healthcare. And if I wouldn't have made it in time, I want to know, how do you have these young youths that go in there and they don't know how to advocate for themselves? If I was in the advocate that I am and would have came in there in the time that I came in despair to just fight for my son, they would have sent my son home in the same traumatic bloody clothes that he had got shot in. And they also was not going to give him any medication because they talking about an opioid, but if he was the contributing factor Caucasian, he would have got it instantly. I advocated for my son. And he got everything. I went to the social workers on down because I was not going to allow my son to be re-traumatized by he just been shot. So how do a healthcare system that's supposed to be relied on, how can we trust them when if I wasn't there, my son would have been re-traumatized again?
Excellent question. Let's hear from some of our panelists that perhaps we have not heard from yet. Let's give them a chance.
Okay, I can speak from the physician perspective, but I can also speak from the fact that I'm an African American and I have had injustices against my family, and that was one of the reasons I decided to go into medicine. I believe that my father died prematurely of colon cancer because the doctor left the polyps in and did not remove them. And so years later, he died, and he was told before he died, when he went to the doctor, he was told, you're bleeding because you ate some tomatoes. I didn't know any better because I was young, but I vowed from that point on that I personally would do whatever I could to ensure that these injustices didn't happen on my watch to the extent possible. So that means getting out here, that means getting out into the community, faith-based organizations, doing whatever we have to do to make it happen, to make people understand what's going on, okay? and I'll say this again and again, I have great colleagues of all different races, colors, and creeds. But I do believe that it is more difficult as a minority in this country and dealing with healthcare. That's just the reality of it. That is the reality. But what do? We can't stop. We have to keep fighting the fight. So the young lady over there that was speaking, take that story that you have and get out there like you're doing right now. Have people hear what's going on, because a lot of people don't understand. A lot of people really don't know. Folks who are racist don't think they're racist, right? They're going to tell you, racism, you're out of your mind. Are you calling me racist? Something's wrong with you. But the reality is we have to keep doing stuff like this, what we're doing right now. And we have to, and for me, and I'll say this as a physician, for me, I have to talk to my colleagues. I have to beat the path so that we're getting education at the level of the doctors, at the level of the health workers that are working in the system. And it has to be continuous. It can't stop. You can't give up. Thank you.
Thank you. We're going to give time for one more question. I'm sorry, okay, so we'll take two because I see you and I see you, okay? This lady here first? Yes.
Hello everyone. So Dr. Mejia, you said something earlier today how when a patient goes and sees you, or a doctor, you can't do much in 15 minutes, which is absolutely right. But I believe that healthcare workers, or the healthcare for families, start from the first person that takes care of you, that takes care of your paperwork, right? Some of these people don't have are not patient with the patients because they are people of color, or because they are older people. I happen to live it right now. I've become the advocate of my mom who is 80 years old, and I make it a point to go to all her doctor's appointments. Why? Because when she goes and arrives with her order, the person that's taking care of her, taking down the information, is not giving her the patience and the care that she needs. She's already afraid that they might say that something is wrong with her, that she might have cancer, that she's gonna die, and for someone to treat her less than, that's the first part. Then there's the language. My mom does speak English, but there are times that it's challenging for her to understand some of this terminology. So what happens, it's like they dismiss her, and it's like, no, hold on. You explain it to her like she's a 3-year-old, right? Yeah. Just like the movie Philadelphia. I learned that there. And then there are the doctors. Now, not all doctors are bad doctors. There are doctors that are there explaining, but then there are doctors like, okay, this is what's wrong with you. Doesn't even look at the patient. It's just looking at the computer. What is wrong? What is it? What's wrong? So all these things that are happening that I'm noticing, that I'm seeing firsthand, again, I become my mom's advocate, but how do you change that? Who do you talk to? Because someone said earlier, the psychiatrist said that when you do speak up, there's a consequence.
Thank you. We've heard the question.
So I agree 100% with you. We can stay here until midnight telling stories about unfair treatment. The reality is African American and brown community Latinx are getting lower standard of care. That's a reality, and many studies and evidence is everywhere. I can tell you as a referral physician, when my patients go to see the specialist, is deplorable, is despicable the way they are treated. When you have a coronary artery disease, your treatment is different if you're Latino or African American. It's completely different. And this is unacceptable. It's simply unacceptable. I think the actions will start with education, making sure we have all the information for the patients they know and they are well informed. A well-informed patient will ask what is required. I don't conceive our patients getting cheaper insulins. Why? Or no high technical procedures. Why? We deserve to have the same treatment. But the reality is our communities, our people are not getting the same. They're getting lower standard of care, and that's absolutely unacceptable. But right. I agree that it's all about starting with a huge portion of education.
Thank you. Last question. Our panelists, will you guys be able to stick around in case some of the audience has more questions? They can come up to you afterwards. Fabulous. Last question.
Good evening. My name is Dalia Calvan Morales from Erie Family Health Centers. My question is more on the healthcare workforce area. One of the things that I've heard tonight is that as organizations, we need to be hiring people from the community that represent our patients. What are some initiatives that are happening right now or that we could be supporting to increase access to educational opportunities for people from minority populations that can help support the future of our healthcare environment?
Well, as a community health worker at Sinai Urban Health Institute, which is the research arm of Sinai Chicago, our CHWs are now being embedded into different departments within the hospital to provide more of that health equity, health education kind of component, and to help reach and spend time with patients that the physicians really can't do in that space. When you talk about empowering your community to be a part of what you're doing at your organization, I think it's really important that you let them know that it's accessible to them to be welcome in your space to even talk about how they can support the efforts that's happening in your organization. I know many organizations who are sitting here now. One of my colleagues at Alivio and in LASE, they are here and they can tell you about how their community health workers, some volunteer. to do the work because it's just that important to share that knowledge. I know I hear people talking about how, why is this happening in hospitals? Because we need people to be voices. We can't just say how mad we are. We have to do something about it. We have to be able to activate and speak and say, I think this is wrong. We shouldn't do it this way. We have to be the agents of change. And I know that, it's a broad thing to say, but it's real stuff and it happens one person at a time. You don't need a whole group of people to go with you to say, I think this is incorrect, and do it with respect so people hear you. But when it comes to community health workers and how you can embed them, reach out to your community. There are a lot of people who feel passionate about the work, they just don't know how to do it. And if they need to be trained, we do have spaces where they can be trained for free. So please, we could talk later.
All right, I'm going to let Dr. Jones answer because he hasn't had very much
I just want to say with Wellness West, we have a project for that. So so for the community health workers, if you're a high school grad and you're potentially interested in the healthcare field, we have a program where you go through for 2 weeks and we actually pay you a stipend, pay you $500 to go through a 2-week training at the Sinai Institute to see what would it look like to be a community health worker. If you complete the training, then we will connect you with one of the primary care practices that are looking for community health workers. We have over 50 openings right now for community health workers. We've hired over 70. So anyone in the audience, if you know somebody that you think might be interested, and community health workers may be like Kim, it might be a long-term vocation. It might be a stepping stone actually to some of these other health professions. So you get in and you work as a community health worker, and then eventually you go on and you might decide, well, I'm going to go into nursing, I want to go to medical school, I want to be a pharmacy tech or a pharmacist. So that's part of this project, is to fund an opportunity for people from the West Side, specifically it's focused on the West Side, that want to start along the healthcare field, and this is a chance for them to explore that.
All right, thank you. We have one more comment from our panelists. You need a microphone.
So I want to go back to your question about how do you stimulate the opportunities for those that are interested in the healthcare profession. And from a public policy perspective, I would say that, and I'm going to go back to healthcare transformation, is, we have to set the stage for organizations that we're funding to hire people from the community in order to affect a change. So that's one aspect, right? And we're not asking them to just hire community health workers. We're also asking them to work with minority-owned companies and businesses, who can actually deliver services and supplies to the healthcare ecosystem in order to affect a change. This is really about community health from our perspective and making, healthier communities. That's one thing I want to say. The other thing, and I know I need to be brief, the other thing is I'm going to go back to pipeline, you all, and I go back to pipeline from this perspective. Yes, community health worker creates an opportunity to get a glimpse into the healthcare ecosystem. But there are other pathways. There are other opportunities, and I say to you that when it comes to cultural competency and making the clinician be culturally proficient, the hospital administrator has a role in that, right? That's not a doctor necessarily. It's not necessarily a nurse. The administrators have a role in that. They create the culture for the hospitals that they run. And so know that is also, again, pipeline and opportunity to affect a change. Thank you.
All right, this has been so enlightening. Thank you to the panelists. I'm going to allow my colleague to wrap. Aileen, thank you.
Okay, thank you. Now, before we turn the mic over to all of you, we want to have a quick lightning round of all our panelists. So to each of us, tell us very briefly what you want to leave this group to know. What do you believe is the most important takeaway? If you can be brief, please. Can we start with Dr. Jones?
I should have prepared for this, but I said, listen, I think there is an opportunity, again, with what we're trying to do with Wellness West, is to involve the community in addressing the needs of the community. It's hiring people from the community to be community health workers, to work with our patients, to really help them to address their social drivers of health. It's bringing together the hospitals, the FQHCs, and the community-based organizations that are addressing those SDOHs. I think what we need community health workers. We need people that are willing to go down this path. And so I hope what comes out of this actually is that you identify either yourself personally or someone else that you know that say, hey, this looks like a good opportunity for them. You go and talk to them, introduce it to them, and let them explore for themselves whether this is a direction they want to go. So thank you. I'm really impressed with the turnout tonight and with the discussion. Thank you.
So my final remarks are that it really does take a village. It's the medical home at the healthcare organizations, and it's how it connects with the community, and it's how it connects with the patient. It's everybody working together, continuing to push the envelope on this and not stopping. Because we've been talking about health equity for many, many years, and we are still having significant issues. So we just have to keep going. We can't stop. Community health workers, we have them at Cook County Health. I don't know if Diane and Andrea are here. Mr. Rocha, anyway, my team, where is my team? We have just a wonderful team, but we want everybody to get better, right? So let's just keep pushing it. That's what we have to do.
I agree with that. I think we know the data, the evidence is there, we know about health inequity. It's time to act. Let's talk in more action. Everyone in this room has a role, as a patient, as a leader, as a provider, anyone. If you're here, it's because you have a role in this. So more action, less talking.
I want to say, everybody just raise your right hand for me. Each of you can be a change agent. All you have to do is vocalize where you see injustices happening and how you can move that needle to help. Don't just sit back and look, activate. That's it.
And I just want to add, the first thing you have to do is to go and vote on November 8th. You don't have an idea about how decisions that are made in Congress at the state level, county level, city level, really. But it's action. The other thing is, we need to really come together with the whole fact that we need a universal healthcare system. I mean, it's not acceptable that everything is run based on a business model. It's not acceptable that the physician has 5 or 10 minutes or 15 minutes with a patient. We really need to change and improve the healthcare system, and I truly believe that our people are having financial difficulty, institutional barriers because of appointment system, et cetera, et cetera. Our community, they're not linked to a medical home, so there's so much that needs to be done. And the final point is we need better data. With COVID-19, we never figured out what was the impact of Native American, American Indian. We never figured out what was the impact of the disability community, or the impact of the LGBT, or subgroup of Asian, or subgroup of Latinos and others. So we really need also better data.
Okay, thank you. And so I wanted you to stay right there about, on data. So my focus is on public policy, and I want to say this to you all. So my birthday is on Monday, November 7th. And I'm asking you for a present. I need a gift from each and every one of you. I need you to make a commitment to do 2 things. One is to understand public officials' perspective on healthcare, and to make sure that their perspective on healthcare and healthcare policy aligns with yours. And then do me a favor, on Tuesday, November 8th, if you have not voted already, exercise your constitutional right and go and vote. It does matter. And what I've shared with you with respect to what the state of Illinois is doing under this current administration around health equity, just in healthcare transformation alone, gives you an idea of what the impact can be from a public policy perspective on the healthcare ecosystem. So are you gonna raise your left hand for me? Are you gonna give me a present? I'm just asking. I'm asking for a gift from you. I want you to go and vote. And I want you to take 10 people with you and go and vote. Thank you very much.
Thank you so much. We really want to acknowledge every one of our panelists. Thank you to Tonight Wellness West for starting the conversation. Thank you to all the community leaders, community organizations working for the people and for starting the conversation about health equity. Thank you on behalf of Univision Chicago. It's my pleasure to be here, Dorothy.